Hi, I'm Dr. Noopur, an oncologist at the Cancer Vet. Today we'll be talking about mast cell tumors in dogs. Now, mast cell tumors, I would say, have a very varied behavior, right from low-grade tumors who, with surgery it's just curative, to some tumors being very, very aggressive where no matter what we do, we lose our patients quite early. So it's a varied, I would say, tumor type that we see. It's also one of the most common tumor types, most common cutaneous, so skin tumor types we see in dogs. Basically, mast cells are part of the body's defense system against allergies or some sort of an inflammatory process going on. These can be present anywhere in the body. So you can find mast cells on the skin, where we most commonly find it, to in the oral cavity, in the abdomen, liver, spleen. Basically, you name it and you can find mast cell tumors there. Some of the breeds who may get this commonly, there are certain breeds like pugs, boxers, golden retrievers, labradors who can commonly get these tumors. Certain breeds like pugs and boxers can get something called as de novo mast cell tumors, which are basically mast cell tumors that are multiple on the body. They're usually small, low-grade ones which don't really spread to other parts of the body, but they can get more than one or two. They can just get multiple ones, which usually surgery can be curative for. So just remember, because if your pug has more than one or two mast cell tumors, it's not like this has spread from one mast cell to the other, while it may. But typically what we see is these are new mast cell tumors, are usually low grade. As part as how to diagnose mast cells, typically these are quite easy to diagnose just on a fine needle aspirate. And on the fine needle aspirate, all we'll be able to tell is, okay, is this a mast cell tumor or not? Typically, the grading system is not as validated. So to know if this tumor is going to act aggressively or not, we'll only know that once we surgically remove it and grade the tumor. A fine needle aspirate is an easy test to do to get a diagnosis. So a lot of times with mast cell tumors, what happens is the pets come in with a history of, oh doctor, there was a small mass that we saw on Fluffy's body, which is becoming bigger, and then sometimes it becomes small again. It's called waxing and waning. And that's a very common behavior for mast cells. This is because mast cell granules have heparin and histamine, which, because of any kind of injury, trauma, even just rubbing the tumor, it can release these histamine, heparin, which can cause the mast cells to become bigger and then again smaller thereafter. Sometimes our patients come with just a huge mass. It's very ulcerative, very edematous, and the pets are really suffering. So there's a wide varied behavior in how we see our patients too. A fine needle aspirate would be an easy test to get a diagnosis. Once we have a diagnosis, then by now, as you know, we need to see where it is spread in the body. So mast cell tumors can typically spread to the local lymph nodes. So for example, if there's a mast cell on the front leg, we might want to see if the prescapular lymph node is enlarged or the axillary lymph node is enlarged, and also take a sample of that lymph node. The other location we would want to look at is the abdomen. So we would want to do an abdominal sonography done. There are certain reports to look at which suggest that even if the ultrasound features are normal for liver and spleen, they might still have mast cell infiltration in them. So for certain mast cells which we think are acting very aggressively or which have shown to have a higher grade on histopathology, we would always want to do a fine needle aspirate of the liver and spleen, just to ensure that there is no disease present in these. And we would do the liver fine needle aspirate even if the liver and spleen look absolutely normal on ultrasound. So that is part of the staging. The other location we would want to look at is the chest. While mast cell tumors don't usually spread to the lungs, it can spread to the lymph nodes in the chest cavity. And just to be safe, we would also want to do chest x-rays. Once these staging tests are done, then we would go on to the treatment aspect of things. Majority of the mast cell tumors, surgery would be the first line of treatment. So we would want to surgically go in, remove the tumor with margins and send that off for histopathology. In certain cases, the mast cells are very big, where we can't get good enough margins or surgically removal may not be possible. in those cases, we can cytoreduce the tumor, which means we can reduce the size of the tumor with certain therapies like chemotherapy or radiation therapy. And once they become to a small enough size, then we can surgically go in and remove it. So surgery is the first line of treatment for mast cell tumors. In case after surgery we feel like these are going to be high grade mast cell tumors, or these will act aggressively, in that case we would want to follow up with chemotherapy as well. So with mast cell tumors, what defines how aggressively it's going to behave is the grade. Okay, higher grade tumors, that's grade 1, grade 2, grade 3 is the grading system, or high grade or low grade. There are two different grading systems in mast cell tumors. One is called Patnaik, the other one is called Kupil. So we would want both the grading systems to be on a histopathology report. And if these are higher grade tumors, we would ideally want to follow up with chemotherapy. So grading is has definitely shown to be prognostic. Higher the grade, worse the prognosis. And certain features on the grading system, which is mitotic index, which shows you how rapidly the cells are dividing, also is prognostic. The other thing that we worry about is certain locations like the oral mast cell tumors or visceral mast cell tumors, which have specifically originally from the liver and spleen, or tumors that are very close to the vulva, the vagina or the penis. We are worried that even though they may be low grade tumors, they can sometimes act like higher grade tumors. So location is also something we worry about. As far as treatment with chemotherapy goes, there are a few drugs that we commonly use. Vinblastine is one of them, which is injectable. The other one which works very well is a drug called Palidia. It's an oral drug, and this drug we give if we are looking at long-term requirement of therapy. Unfortunately, it's not available in India, but we've been able to source it from Singapore or some other locations. But I really hope we can find that in India soon, because it is one drug that we use very, very commonly. In short, mast cell tumors have a varied behavior. So please, you would need to see an oncologist if your dog has been diagnosed with mast cell tumors, because there are a lot of nuances when it comes to treatment of these tumors, and we don't want to undertreat. So we don't want to treat a high grade tumor with only surgery, because these can act very aggressively. But we also don't want to overtreat, which means tumors that can just easily be treated with surgery alone, we don't want to follow up with chemotherapy and so on and so forth. So this is in short about mast cell tumors in dogs.